If you're over 60 and sometimes feel dizzy when you stand up, don't ignore it. Many seniors think it's just part of getting older, but doctors warn that this sudden dizziness could be your body trying to tell you something important. And in some cases, fixing one small daily habit can make a big difference. So if this has ever happened to you, stay with me because what most people over 60 overlook might surprise you. Imagine this moment. You're sitting in your chair, watching TV, or maybe getting up from the dinner table. You stand up, and suddenly the room feels like it's spinning. Your head feels light. Your balance feels off. Sometimes you may even need to grab a wall or chair to steady yourself. Many seniors experience this exact feeling. It may last only a few seconds, but it can feel scary. And the biggest concern is not just the dizziness itself, it's the risk of falling. Doctors often warn that falls are one of the biggest dangers for adults over 60. And something as simple as standing up too quickly can sometimes trigger that dizzy feeling. But here's the important question. Why does this happen? Many older adults across the United States experience dizziness when standing. Doctors and senior health specialists say this becomes more common with age because the body's balance systems change over time. Blood circulation slows. Muscles become weaker, and the body sometimes takes a few extra seconds to adjust when you move from sitting to standing. Many seniors don't realize that this brief moment, those first few seconds after standing, can be when your body struggles to keep blood flowing to your brain, and when the brain briefly receives less blood, dizziness can happen. But that's only part of the story, because what most people over 60 overlook are the hidden causes behind this problem. Let's talk about a few possible reasons this dizziness happens after age 60. Understanding these can help you take simple steps to prevent it. Cause number 1, blood pressure changes. One common reason is something called a sudden drop in blood pressure when standing. When you sit or lie down, blood settles differently in your body. When you stand, your body needs to quickly push blood back up to your brain. In younger people, this adjustment happens very quickly. But after 60, the body may take longer to respond. So for a few seconds, your brain may receive slightly less blood flow, and that can cause dizziness. Many seniors don't realize this is one of the most common reasons for feeling lightheaded after standing. Cause number 2, dehydration. Here's something surprising. Even mild dehydration can make dizziness worse. As we age, our sense of thirst often becomes weaker. You may not feel thirsty, even when your body actually needs water. Doctors often warn that when the body is low on fluids, blood volume can drop slightly. And that makes it harder for your body to maintain stable circulation when you stand up. This is why many seniors feel more dizzy in the morning or after long periods without drinking water. Cause number 3, weak leg muscles. What most people over 60 overlook is the role of leg muscles. Your leg muscles help push blood back towards your heart when you stand. Think of them like small pumps working with your circulation. But if those muscles become weaker with age, or if you sit for long periods, your circulation may not adjust as quickly. This can increase the chance of feeling dizzy when standing. And that's why movement plays a bigger role than many seniors realize. The good news is that many seniors can reduce this dizziness with a few simple daily habits. Let's go through 3 practical things you can try. This may sound simple, but it can make a big difference. Instead of standing up quickly, try this method. First, sit on the edge of your chair for a few seconds. Move your feet slightly, then slowly stand up. This gives your body a little extra time to adjust blood flow and balance. Many seniors find that just slowing down this movement reduces dizziness significantly. Doctors often warn that hydration becomes more important with age. Try drinking small amounts of water throughout the day instead of waiting until you feel thirsty. A glass of water in the morning can be especially helpful because the body often becomes slightly dehydrated overnight. Keeping your body well hydrated supports better circulation and can reduce feeling woozy. Before standing, try moving your legs for a few seconds. You can gently tap your feet on the floor or tighten your leg muscles while sitting. This simple movement activates your circulation and helps blood flow more efficiently when you stand. Many seniors don't realize that these small movements can help prevent that sudden dizzy feeling. But there's one surprising reason many seniors overlook, and fixing it can make a big difference. It has to do with how long you stay in one position. Sitting still for long periods can slow circulation throughout your body. When you suddenly stand up after sitting for an hour or more, your body may struggle to adjust quickly. That's why doctors often suggest standing, stretching, or walking briefly every 30 to 60 minutes. Even short movement breaks can help your circulation stay active and reduce dizziness. Now, occasional mild dizziness can happen to many seniors. But there are times when it's important to speak with a healthcare professional. Doctors often warn that dizziness should not be ignored if it happens frequently or becomes severe. You should consider talking to your doctor. If the dizziness happens often, you feel like you might faint, you experience chest pain, you notice sudden weakness or numbness, or the dizziness leads to falls, these symptoms may signal something that needs medical attention. It's always better to check early rather than wait. Here's the reassuring part. Many seniors improve this issue with small lifestyle changes. Standing up slowly, drinking enough water, moving your legs, and staying active during the day. These simple habits may seem small, but they can help your body maintain better balance and circulation. And when your body adjusts more smoothly, that sudden dizzy feeling often becomes much less common. Remember, your body is always sending signals. Learning to listen to those signals can help you stay safer and healthier as you age. If you found this helpful, consider subscribing for more simple health tips, designed especially for adults over 60. We share easy, practical advice to help you stay strong, balanced, and independent as you age. And if you know someone who often feels dizzy when standing, consider sharing this video with them. It could really help. This video is for educational purposes only and is not medical advice. Always consult a qualified healthcare professional for diagnosis or treatment of any medical condition.